As Uganda's national examinations begin, mental health advocates warn that the pressure to perform is pushing many learners to the breaking point. The fourth Marching for Quality Education Day in Kampala brought together education experts, counselors, and curriculum developers to discuss how to make schools more emotionally supportive spaces.
So the issue is that the problem is real. This problem is even highlighted in the World Health Organization reports that Uganda has the highest mentally disturbed people on the continent, right? Now, we've got to begin to see where the problem comes from.
According to data from the Ministry of Education, 1 in 3 Ugandans is currently battling a mental health disorder.
This is a very typical season to be on our safeguard when it comes to mental health. Most of our learners are going to embark on their examinations. That is the O levels, the A levels, and the primary levels. Post results return, we tend to register very many incidences of mental ill health in form of suicide attempts by learners simply because they have not gotten the results they intended.
The discussion also emphasized the urgent need for functional counseling departments in schools where students can seek help without fear or stigma.
Today we talked about suicide and anxiety, but there are so many. The number of cases that we're getting are just so rampant, and also if left unsolved.
The National Curriculum Development Center explains that the new competency-based curriculum provides opportunities to integrate emotional and social learning into education system.
One of the core ingredients of the competency-based curriculum is what we call the generic skills. So learners are exposed to activities that allow them to work in teams. They are exposed to collaborative engagements. They do a lot of work that allows them to discover. So there is teamwork, there is collaboration, there is creativity and innovation.
Advocates further stress that mental health and quality education are inseparable and both depend on motivated, emotionally stable teachers.
If a teacher is mentally unstable, if a learner is mentally unstable, then they are not going to learn and they are not going to teach effectively. It becomes imperative to create that enabling environment where a teacher feels they have the support system. A healthy teacher is a healthy mind and leads to a healthy child.
As Uganda works to improve learning outcomes, education leaders insist that mental well-being must remain at a core, because a stable mind is foundation of every child's success. Experts